Hi BookTube, it's Amy. I'm back reading from the Anatomy of Bibliomania by Holbrook Jackson. We're on page 290 of my edition with a section titled Preservatives and Prophylactics. Among the numerous evidences of the medicinal disposition of books, I find several allied instances of fertilization and preservation, as when Lady Constance in Tancred Ginnowed her mind by reading French novels, and Matthew Arnold read about 100 lines of the Odyssey to keep himself from putrefaction during the drudgery of his inspectorship of schools. Our footnote there pointing us to letters. The preservative character of books had before his day been observed by Payne Fisher, who caused to be printed on the title page of his Elegia Sepulchria the words Miramur Peris Homines Monumenta Fasticunt Anson and Nescia Miserum sed Monumenta Mori Ovid, which is thus Englished by a wit of that age: men timely die, and princes day by day moulder to dust, but books will live for aye, and re-embalm us in the coldest day. From Dibdin's Bibliophobia. Dibdin's Bibliophobia. So it is no news to learn that books are the great preservatives of history. Here all that lie no more, preserved they lie, in tombs that open to the curious eye. Some lines of poetry from George Crabbe's The Library. And that, as the poet Vaughan sings, Caesar had perished from the world of men, had not his sword been rescued by his pen. From on Sir Thomas Bodley's Library, those lines. Some, as Dr. Rosenbach argues, argue that book collecting acts as an elixir of life, keeping men young, a new type of life insurance. The wonderful library of Mr. W.A. White of New York would take away the load of years from a Methuselah. Even to read over the partial list of his treasures would cause rejuvenation. And he asserts that his own Uncle Moses, a notable bookseller and book lover of Philadelphia, grew younger and younger as he sat year after year surrounded by books, that the reading of them may well be as efficacious in the opposite effect of giving ripeness to youth, is proved by Fuller, who says, "History maketh a young man to be old without either wrinkles or grey hair, privileging him with the experience of age without either the infirmities or the inconveniences thereof." From Lubbock's Pleasures of Life. Finally, in this class of their properties, they are prophylactics against several diseases. Pliny the Younger strengthened his digestion and thus prevented many ills by reading aloud Greek or Latin orations, and Dibdin records how the Nestor bibliographers of his day ended a tirade against an epidemic of bibliophobia with a challenge to typhus, scarlatina, and even to the then prevailing cholera, feeling proof against those evils so long as he possessed his beloved books. And if fate held the worst for him, he was then an octogenarian. He would die content, hugging his Homer. For another bibliomaniac, Dibdin advocates Russian leather as a charm and protection against epidemic miasmata of every description. Give him, he says, the treble-rowed entrenchment of his library, and he will snap his fingers alike at the arrows of fate and the canker of care, both of which predispose us to other ills. Horace Walpole longed for a catalogue of lounging books that one might take up in the gout, low spirits, ennui, gay poetry, odd whimsical authors as Rabelais, etc. Even a catalogue raisonné of such might be in itself a good lounging book. Sterne commends his own Tristram Shandy as such a book, medicinal to that end. "'Tis wrote," he saith, "against the spleen, in order, by a more frequent and a more convulsive elevation and depression of the diaphragm, and the succusations of the intercostal and abdominal muscles in laughter, to drive the gall and other bitter juices from the gall bladder, liver, and sweetbread of his Majesty's subjects, with all the inimitish passions which belong to them, down to their duodenums. And at the end of the 4th volume, he once again dilates upon the curative properties of his novel. True Shandianism, he says, opens the heart and lungs, and like all those affectations which partake of its nature, it forces the blood and other vital fluids of the body to run freely through their channels, and makes the wheel of life run long and cheerfully round. And there is even some little evidence worth further exploration by the medical profession, which suggests that even paper and ink may be taken with a beneficial result in some distempers. Samuel Butler cites an instance of a man who was cured of a dangerous illness by swallowing the doctor's prescription, which he understood to be the medicine itself. Bulwer Lytton would promote this faith to a practical account by forming a curative library whose compartments should no longer bear such labels as philology, natural science, poetry, but according to the disease for which they are severally good, bodily and mental. Up from a dire calamity, or the pangs of the gout, down to a fit of spleen or a slight catarrh. In such a bibliotorium, treatment would be prescribed for all diseases. He advises light reading with a whey posset and barley water for a cold, biography preferably of good men when someone's sorrow, that is yet repairable, gets hold of your mind like a monomania. And when heaven, having denied you this or that, you feel that life is blank and empty, he prescribes the book of books, the lingam vitae, the cardinal medicine for all. But books, taken indiscriminately, he expostulates, are no cure to the diseases and afflictions of the mind. Scientific application is essential. No use flying to a novel or the last light book of fashion in a great sorrow. One might as well take a rose draught for the plague. Goethe, he says, was a physician who knew how to heal himself, for when he lost his son, he found solace in a science that was new to him. So Bulwer hastens to prescribe a course of science and hard reasoning for all irremediable sorrows. Bring the brain to act upon the heart, he orders, as a counter-irritant. If science be too much against the grain, take a strange language, Greek, Arabic, Scandinavian, Chinese, Welsh. For loss of fortune, he advises something elegant and cordial, since here the head rather than the heart is affected, and thus he finds the higher class of poets a valuable remedy. For hypochondria, what better than a brisk course of travels, especially the early, out-of-the-way, marvelous and legendary. For that vice of the mind which he calls sectarianism, not religious, but little, narrow prejudices, gossiping, prying, backbiting, a large and generous, mildly apparated course of history. He finds better than the hellebore with which the old leeches of the Middle Ages purged the cerebellum. He cured a disconsolate widower who obstinately refused every other medicament with a strict course of geology. And he brags of a not less notable cure of a young Cambridge student who had caught a cold fit of free thinking with great shivering from wading out of his depth in Spinoza. He omits to name the remedy, although it was certainly efficacious, since his patient's theological constitution became so robust that he ate up 2 livings and a deanery. And that brings us to the end of that section on preservatives and prophylactics. The next section here on page 293 is titled The Claim That They Are Cure-Alls Discussed, which is a little bit of a longer one for us here, but we'll pop the bookmark in for today.